Topic is basal ganglia and the Parkinson disease caused due to dysfunction of basal ganglia. What actually is the basal ganglia? Basal ganglia are a group of deep subcortical nuclei located at the base of the brain. See, basal ganglia are group of subcortical nucleus located at the base of the forebrain. They primarily involved in the control of posture and movement. So, any dysfunction of this basal ganglia causes posture and movement problem. Unlike cerebellum, basal ganglia do not receive inputs directly from the spinal cord. Like cerebellum receives inputs directly from the spinal cord, but not basal ganglia. They also do not project directly to the brainstem areas that control motor activities. They receive inputs mainly from cortex and project to the cortex via thalamus. They receive inputs mainly from cortex and they project not directly to the cortex. They project through thalamus. Basal ganglia project mainly to brainstem areas via their cortical connections. Therefore, basal ganglia mainly influence extrapyramidal functions and consequently they are classified as important extrapyramidal structures. So, they project through the extrapyramidal tracts, right? So, any lesions may cause the extrapyramidal dysfunctions, right? Lesion of basal ganglia produce abnormal movements and severe deficits in control of postures. Okay, any lesion in basal ganglia causes abnormal movements and severe deficits in the control of posture. Let's see the anatomical organization of this basal ganglia. Basal ganglia mainly include caudate nucleus, putamen, and globus pallidus. See, three main structures. What are the caudate nucleus, putamen, and the globus pallidus? Subthalamic nuclei and substantia nigra are also included in this basal ganglia. The caudate nucleus and putamen together known as striatum, and putamen and globus pallidus are commonly known as lenticular nucleus. See, you remember this diagram so that you can write the answer. See, this is the putamen. Putamen and caudate nucleus together known as striatum. Putamen and this globus pallidus together known as lenticular nucleus. See, substantia nigra also included in the basal ganglia. Substantia nigra consists of two parts, parsa compacta and parsa reticulata. And thalamus superior colliculus and subthalamus are present nearby the basal ganglia. Okay, you have to remember these three structures: putamen, caudate nucleus, globus pallidus. Putamen and caudate nucleus together called striatum. Putamen and globus pallidus together known as lenticular nucleus. Globus pallidus is divided into an external and internal part. Substantia nigra is divided into parsa compacta and parsa reticulata. See how the basal ganglia and cortex are togetherly involved. Means how they functions as a circuit. We will see. See, first striatum receives inputs from cortex. See, this is if you think this is a cortex. From the cortex, first striatum receives inputs. Striatum receives inputs from cortex and thalamus. Thalamus and cortex together sends inputs to the striatum. Then striatum receive inputs from cortex and thalamus, striatum sends outputs to globus pallidus. Okay. Then globus pallidus project to thalamus. Information received by thalamus is converted back to cortex, completing the circuit. See, first cortex, then thalamus, striatum, globus pallidus, again thalamus. See, whole circuit will be completed. Within the basal ganglia and the cortex, the process will be run. Okay. See, um, basal ganglia's functions have two pathways, direct pathways and indirect pathways. Direct pathway, how it means thalamus sends signals to motor cortex, from motor cortex to the striatum, from striatums to globus pallidus internus, and then thalamus. This direct pathway is a excitatory type, means it causes excitation of the basal ganglia. Next, indirect pathway. Indirect pathway from thalamus to motor cortex, from motor cortex to striatum, from striatum to globus pallidus externa, then subthalamic nucleus, then globus pallidus interna, then thalamus. See, this part is extra from if we compare with direct path. This pathway causes the indirect pathway to be inhibitory. So, involving of these two subthalamic nuclei causes this pathway inhibitory, whereas direct pathway causes excitatory effect. Next, functions. Let us discuss the functions. Functions. Remember one important word will be there in every sentence. That word should be represented in the exam so that you can avoid a good marks. The neurons of basal ganglia are observed to discharge before the movement begins. Absorb to discharge before the movement begins. This indicates that basal ganglia is involved in planning and programming of motor activities. See, in this sentence, planning and programming of motor activities is the important thing. So that you have to write basal ganglia involved in uh, movement before beginning, so that we can consider that basal ganglia is involved in planning and programming of the motor activities. So these words are important. You should be mentioned in the answer. Next, basal ganglia controls posture. Posture is the important. Basal ganglia thalamic cortical projection to brainstem influence descending pathways that control posture. Disease of basal ganglia result in profound postural abnormality. See, basal ganglia control posture, right? So any dysfunction of the basal ganglia causes the diseases which results in postural abnormalities. In this posture and postural abnormalities is the important. Next, basal ganglia inhibits stretch reflexes by stimulation of caudate nucleus. This is achieved by stimulation of inhibitory motor cortex through thalamocortical feedback pathway and stimulation of inhibitory reticular formation. See, in this, it inhibits stretch reflexes. Is an important one, so that you should remember this word. Next, neostriatum regulates subconscious gross movements. This point is very important. You should mention. Neostriatum regulates which movement subconscious gross movement means involuntary. These movements will be take place. Next, basal ganglia also play a role in cognitive functions. This is especially performed by the caudate nucleus through its connections with the frontal portion of neocortex. Lesion of caudate nucleus results in deficit in performance based on learning. So, see, basal ganglia play a role in cognitive functions. So, and also neocortex involved in other functions. So, any deficit of this or any lesion to this caudate nucleus results in deficit in performance of based on learning. So, cognitive function means learning also will comes under that. So, any lesion may cause a person will suffer from performance in based on learning. Next, lesion of head of the caudate nucleus is associated with dysarthric aphasia. Means dysarthric. Arthric means pronunciation, like expelling the words. Difficulty in articulating words. They feel to talk, feel abnormal to talk, right? They they feel hard to talk some words. Okay. Next, globus pallidus provides inputs for appropriate muscle tone for skilled movement. See, globus pallidus provide inputs appropriate muscle tone for skilled movements. Okay. Next, substantia nigra is a center for coordination of impulses essentially for skilled movements. So, what actually basal ganglia consists of caudate nucleus, substantia nigra, globus pallidus, putamens. All are there. Na? So each part of this basal ganglia have each function. So like that, substantia nigra has the function that involved in coordination of impulse essential for skilled movements. So this is the important one. Its basal ganglia controls associated movements that occur automatically and normally with various body movements. Next, associated movements you should remember. It's a lesion of basal ganglia in animals does not lead to significant motor deficit. However, diseases of basal ganglia in humans result in severe motor dysfunction. So, any deficit in this basal ganglia cause severe motor dysfunction. See, in functions, you should remember that movement helps in planning and programming of movement, controls posture, inhibits stretch reflexes, neostriatum, neo means new striatum, regulates subconscious gross movements, cognitive functions, whereas left caudate nucleus is a help in lesion causes this dysarthric aphasia, and the globus pallidus provides input input for appropriate muscle. You should remember this muscle tone and skilled movements. Next, substantia nigra coordination of movements. Next, basal ganglia control associated movements. So these are the important keywords you should be mentioned in the answer. Next, let us discuss about the dysfunctions of basal ganglia. See, uh, in university exam they ask like they give the symptoms and also ask the define basal ganglia or define the structure involved in it and uh, discuss about the disease. So they gives he has resting tremors, he has movement, he has he has problem in movement, posture, and he has some dysarthric functions. So that these are the symptoms for Parkinson disease. So resting tremors means you should remember that that is the Parkinson disease. So if they give like this and ask that define the structure involved in the disease, so that time you have to mention this answer. So let us see dysfunctions of basal ganglia. Parkinson disease. Parkinson disease results from degeneration of nigrostriatal dopaminergic neurons. With age, there is progressive loss of dopamine and dopamine receptors in the basal ganglia. When these processes accumulated, Parkinson results. See, Parkinson disease is caused due to the degeneration of basal basal ganglia. Means basal ganglia's main function is to secrete the dopamine. So when the basal ganglia's degenerate as the age progress, therefore there will be loss of dopamine and dopamine receptors. So that dopamine is a wa- one of the important sorry neurotransmitter, right? So this neurotransmitter is very important, very much important in the movement. So when this neurotransmitter decreases in the body, there will be decreased movement. Okay, so there will be the problem in the movement and also in other body functions. Causes: idiopathic. The cause of the cause of degeneration of dopaminergic neurons is not exactly known. See, idiopathic means there is no cause, not at known. Some are thinking that it is due to the age, due to the progressive age, there will be degeneration. At now, it is not confirmed, so it causes degeneration of dopaminergic neurons is not exactly known. What are the causes for this degeneration is not at now. See, it occurs secondary to chronic use of many drugs like phenothiazine, D receptor blockers, etc. See, some people uses these drugs. In that people also Parkinson disease is observed. So think some are thinking that it is maybe due to the use of these drugs may cause this Parkinson disease. Next, MPP has recently described that methyl phenyl pyridinium concentration in the brain of Parkinsonism is high. MPP is formed from methyl. MPP is formed from MPTP by the action of MAO enzyme. MPP rapidly accumulate in the neurons of basal ganglia and destroy them. See, when scientists examine that basal ganglia of these Parkinson patients, this methyl phenyl tetrahydrophonium is get converted into methyl phenyl pyridinium in the presence of mon by the action of monoamino oxidase B. So this concentration of this substance in the basal ganglia of the Parkinson people is very high. So this may cause thinking that this may destroy the basal ganglia, but not yet confirmed. Next, what are the features of the Parkinson disease? There are two types of features: hypokinetic and hyperkinetic movements are observed in the Parkinson. Means decreased movement and increased movements. Hypo means decrease, hyper means increase. Okay, let us discuss the hypokinetic movements. AB, you remember, ABD, ABD for hypo. A means agnesia, B means bradykinesia, D means decreased movement. See, agnesia is defined as difficulty in initiating movements and decreased spontaneous movements. Means they feel difficulty to start the movement or to initiate the movement. Next, bradykinesia is defined as slowness of movement. Means even they feel to start the movement, that is agnesia. If they started also, they feel they will show slow movement. So that is called bradykinesia. Next, decreased associated movements. See, example of associated movements are swinging of the arms during walking or the facial expression during speaking. These associated movements are grossly diminished in Parkinson. The patient suffering from Parkinsonism speaks without any emotion. See, they have mask face. Means that see, while talking, if it is a happy thing, we will say by laughing, right? But this person cannot show any expressions. They are without emotional expressions, so their face is called mask like face. So means there is no associated with. While walking, we should normal the person will use his hands while walking, right? Swing his hands, but these patients won't show such actions. Okay. Next, hyperkinetic movements. Rigidity and tremor and festing Festington gait. Rigidity. of Parkinson is different from spasticity that occurs in upper motor neuron paralysis. In rigidity, the motor neuron discharge is increased in both agonist and antagonist. Therefore, the limbs offer resistance to passive bending throughout the movement. Sometimes cogwheel rigidity is also seen. However, clasp knife spasticity of upper motor is never seen. See, you remember rigidity means increased muscle tone, like they have uh, their limbs are resistant to passive bending throughout the movement. They can show passive bending throughout the movement. However, there is no spasticity observed as observed in the upper motor neuron paralysis is seen in upper motor neuron paralysis. We can see the spasticity, but not in the Parkinson patient. Next, tremors. Tremors occurs due to regular alternating contraction of antagonist muscles at a frequency of about 8 per second. Typically, tremor is observed only at rest. Once patient initiates the movement, tremor disappears. This is described as resting tremor. Resting tremor is the key word of this whole Parkinson disease. See, tremors are seen in other diseases also, whereas in resting tremor is only seen in the Parkinson disease. Means even they are rest, it will be tremors will be seen. Once if they want to do any work, it will be disappeared. Okay. It's fasting time. Patient walks in an attitude that as if he is trying to catch the center of gravity. Usually he bends forward but does not fall. Instead takes short and shuffling step. See, the patient will walk like bending. He will bend in front side and it feels like falling. But and he feels like to catch the center of gravity. See, once you see the patients in the postings so that you can easily observe how it how the patient will be. Next, it is the treatment. See, what we told, there will be decreased dopaminergic neurons, right? Means answer will be the giving of dopamine tablets, right? But um, the keyword you should remember is uh, dopamine. Dopamine. Dopaminergic neurons are decreased and dopaminergic receptors are decreased. So we have to give dopamine as a tablet. See, mostly they give levodopa. You should mention this during Viva so that they will award a good marks because dopamine cannot cross the blood-brain barrier. So levodopa is a quaternary structure, so it can cross the blood-brain barrier. So most of the neurologists suggest the levodopa as a tablet for this person. Okay. Let us see. Replacement of dopamine. Dopamine cannot cross the blood-brain barrier. Therefore, L-dopa, a precursor of dopamine that easily crosses blood-brain barrier, is the drug of choice for Parkinsonism. It also helps to repair dopamine deficiency. Other dopamine agonistic like bromocriptine also use it. See, dopamine cannot cross the blood-brain barrier. So, L-dopa means levodopa is used as drug of choice which can cross the blood-brain barrier. If you mention this point, the external will award a good marks for you. Next, anticholinergics. Though Parkinson disease occurs due to dopamine deficiency in the striatum, the alteration of in the ratio of dopamine to acetylcholine plays an important role. Therefore, injection of anticholinergics that decrease acetylcholine concentration in the basal ganglia and re-establish acetylcholine dopamine ratio improves the symptoms. See, dopamine to acetylcholine ratio something it will be maintained every time in the body. So when dopamine decreases, acetylcholine will be automatically seems to be increased, right? So if we will give anticholinergics, so that acetylcholine will be also decreased, so the ratio will be maintained, such that some symptoms can be decreased. Okay. Next, deprenyl inhibits monoamine oxidase B, therefore prevents formation of MPP from. We discussed right that MPP is formed from MPTP in the presence of monoamino B oxidase, there will be formation of MPP. So, if we will give deprenyl, this MPOB enzyme is inhibited such that uh, there will be no formation of MPTP. So, there will be no formation of MPP from this MPTP. Next, transplantation of adrenal. Transplantation of adrenal medulla from one of the adrenal gland of the patient into his basal ganglia helps in regenerating the dopaminergic gland. See, adrenal gland produces dopamine, right? Uh, So, if we transplant the adrenal medulla, adrenal gland consists of cortex and medulla. Medulla produce this dopamine. So, we can transplant the medulla such that help in regenerating the dopaminergic neurons. Next, implantation of fetal basal ganglia. Implantation of tissue from the basal ganglia of fetuses into basal ganglia of the patient improves the conditions. See, fetal stage is very active and very dopaminergic neurons are very active to produce dopamine. So, this dopaminergic basal ganglia, if we take from the fetuses and implant into the patient with this disease, there will be improved conditions. Next, transplantation of gloma cells. Recently, for treatment of Parkinsonism, gloma cells from carotid body are isolated and transplanted into basal ganglia. Gloma cells release dopamine locally. This has been found to be encouraging. So, recent researches are going that gloma cells can produce dopamine locally, so that gloma cells can be transplanted. Thank you.